Hi everyone, this is Module 12. Today we're going to be talking about physical activity in a couple of special populations. Specifically, we're going to talk about physical activity in pregnancy and physical activity in children and adults. So first, let's talk about physical activity in pregnancy. There are a number of physiologic changes that happen during pregnancy. So first, we're just going to talk about these baseline changes, and then we'll talk about how those are related to physical activity or exercise. So first, pregnant women experience an increased blood volume of 30 to 50%. So they actually have considerably more blood inside their body than they do before they were pregnant. This is accompanied by an increase in the volume of red blood cells. These are the cells that bind oxygen. But the increase is not to the same degree. So what that means is that pregnant women are not as good at carrying oxygen. And therefore they may feel fatigued. Things like exercising, even climbing stairs and so forth, they can be more fatiguing than they were prior to pregnancy. And then they have a decreased hematocrit, which is the percentage of blood that is red blood cells, meaning they have a lower oxygen carrying capacity. There's an increased resting heart rate, meaning the heart is obviously pumping faster, even at rest. They have increased stroke volume and cardiac output. This means that the heart's pumping harder and it's pumping more blood. So this is probably due primarily to the increased blood volume. If there's more blood, the heart just has to pump more frequently and harder to keep up. And then they have an increased metabolic rate of about 300 kilocalories per day. So the concept of eating for two is actually incorrect. Really, pregnant women need to consume about an extra 300 calories per day. And then pregnant women also experience progressive insulin resistance. So as the pregnancy progresses, going from the first to the second to the third trimester, they become increasingly resistant to insulin, which sounds like a bad thing because with diabetes we talked about insulin resistance, but actually in pregnancy this, at least to some degree, is good because what it does is it ensures that there is adequate glucose in the bloodstream for the developing fetus. And then the GFR, this is the glomerular filtration rate. It's a fancy term for the filtration rate of the kidneys. This increases by 50%. So there's an increased need to go to the bathroom for pregnant women, and that is sometimes joked about, but it's actually, there's a biological cause as well. And then of course there are center of gravity changes. One study estimated that a pregnant woman's fall risk is similar to that of a 70-year-old woman because of all the balance difficulties associated with these center of gravity changes. And so most falls are actually in the second trimester, at the beginning of the changes of the center of gravity. Later in the third trimester, the woman has become more used to the changes and is probably moving more slowly as well. So the greatest fall risks are actually in the A frequent question asked by newly pregnant women is how much weight should I gain? And so the answer to that is here on this slide. This is the Institute of Medicine guidelines for weight gain during pregnancy. And essentially the recommendation is that it depends on what the woman weighed prior to pregnancy, or what her BMI was prior to pregnancy. So you can see that women who are underweight, meaning they have a BMI less than 18.5, they should gain somewhere between 28 and 40 pounds over the course of the pregnancy. A woman who's considered to be normal weight by BMI, meaning 18.5 to 24.9 BMI, they should gain between 25 and 35 pounds. An overweight woman should gain between 15 and 25 pounds, and an obese woman should still gain weight, but only somewhere between 11 and 20 pounds. So where does all this additional weight go? Some of it is breast tissue, some of it is, of course, the actual baby. The placenta weighs between 1 and 2 pounds at delivery. The uterus increases in size 1 to 2 pounds. Amniotic fluid. The increased blood volume, of course, has additional weight. Stores of fat and protein increases, and then other body fluids. So all of that together comes to somewhere in the range of 25 to 35 pounds. So now let's talk about physical activity in terms of pregnancy. So there is still a lot of misconception about this. Is physical activity safe for pregnant women? And then really a different question is it beneficial? So historically, the concerns with exercise or physical activity during pregnancy have been that there could be decreased blood flow to the placenta. When a person exercises, blood flow is shunted away from the digestive system, the kidneys, etc., towards the skin for thermoregulation and towards the exercising muscle. And so the thought would be that during exercise, a pregnant woman may have decreased blood flow to the placenta because that blood needs to go to muscle and skin. There could be thermoregulation problems, meaning that increased core body temperature could potentially provide harm to the developing baby, possibly diminished growth. Maybe the woman is burning more calories than she would be if she weren't physically active, and that could impact growth of the baby. At risk for falls, and then there's been concern about increased risk of miscarriage with physical activity during pregnancy. So again, those are just the potential concerns. So now let's talk about what the recommendations have been. In 1985, the very first guidelines for physical activity pregnancy were released, and they said that a pregnant woman should keep her heart rate under 140 beats per minute, which is probably for most women a brisk walk, not running, not doing anything terribly strenuous. In 2002, there were updated guidelines that said pregnant women can be physically active 30 minutes per day most days of the week, and recreational physical activity is considered to be safe. So it's fairly vague, but they did get rid of the 140 beats per minute limit. So the 2008 physical activity guidelines for Americans have a section about pregnancy. And so this is the most recent version, and this is what they say. They say that healthy women who are not already highly active or doing vigorous intensity activity should get at least 150 minutes per week moderate intensity aerobic activity during pregnancy and the postpartum period. So essentially they should do the same as everyone else, the same as the typical American adult. And then in the section that you see on the right of the screen, the guidelines also say pregnant women who habitually engage in vigorous intensity aerobic activity or are highly active can continue physical activity during pregnancy and the postpartum period, provided they remain healthy and discuss with their healthcare provider how and when activity should be adjusted over time. So for the discussion today, one of the prompts involves talking about whether a pregnant woman who ran the Chicago Marathon a few years ago, whether that was a good idea or not. Her doctor approved that because she had been incredibly active prior to and throughout the pregnancy. So what the guidelines say essentially is, as long as the woman remains healthy and discusses with her healthcare provider, really what she's been doing prior to pregnancy should continue to be safe. Now that doesn't mean the woman will want to do that, but it typically not dangerous. Alright, this is some research published in 2010 about what pregnant women themselves believe about the safety and efficacy of pregnancy activity. So I want to highlight these two questions, and then the first column is 3 months before pregnancy, and then in the first trimester, that's the first 13 weeks or so of the pregnancy, and then the second trimester. So question 10 said, do you agree or not that pregnant women will gain some benefit from moderate exercise that feels somewhat hard? Before pregnancy, about 79% of women said they agreed with that. In the first trimester, about 86% of women agreed with that. And in the second trimester, about 88% agreed with that. But look at question 11. Pregnant women will gain some benefit from vigorous exercise that feels hard or very hard. Only about 13% of women prior to pregnancy agreed with that, 18% agreed in the first trimester, and closer to 19% in the second trimester. And there's other research showing similar results, that most pregnant women think moderate intensity exercise is okay, and not very many think vigorous exercise is okay, even though the guidelines say if the woman's been active prior to pregnancy, it's okay to, So let's look at, this is the percentage of the providers who agreed with certain questions. So question 10, for instance, on the far left-hand side of the screen, did they believe that exercise is beneficial? 100% of MDs did, 100% of DOs, and 97% of the midwives agreed that for pregnant women, exercise is beneficial. Question 14 said sedentary women should not start exercising. 16% of MDs agreed with that, 7% of DOs, and 6% of nurse midwives, even though the guidelines say that all women should get 150 minutes per week during pregnancy. Question 18 is the one I really want to highlight. Do you agree or not that heart rate should stay less than 140 beats per minute? This was in 2010 that this study was done. 67% of the MDs agreed with that, 43% of the DOs, and 74% of the certified nurse midwives, even though those recommendations went away in I think it was 2002 when that recommendation was changed. But more than half still agree with that statement. Really the point is that healthcare providers, very few of them know much about exercise in pregnancy, even though their full-time jobs are to care for patients who are pregnant and postpartum. So did they weigh less? Yes, they did. But actually, what's not reflected on the slide is that they weighed less, but still within a healthy range. So they weighed less, but they were also less fat, which is probably. We've talked about gestational diabetes already in Module 11. Women who have gestational diabetes are higher risk for having a baby that's macrosomic, meaning too large. They're at higher risk for C-section and forceps deliveries and a number of other birth complications. Basically what happens is that having gestational diabetes causes the baby to put on extra weight and be very large. So can physical activity during pregnancy affect the risk of gestational diabetes? This is a study, a meta-analysis study. You've seen a couple of these before, but basically this is a study of a whole bunch of other studies where they're looking at odds ratios. And so what they found is that it's kind of hard to see in this figure, but the risk ratio, or the relative risk for physical activity during pregnancy and gestational diabetes, was 0.72. That means a 28% reduced risk of gestational diabetes in mothers who are physically active. So is there an effect? Yes, and it's fairly strong. Another very dangerous condition that can happen during pregnancy is called preeclampsia. Thankfully, it's pretty rare, but it's characterized by both high blood pressure and protein in the urine. And it's called preeclampsia because it's a precursor to a condition called eclampsia, which is a seizure disorder, and that's often fatal. So the only way to cure preeclampsia is to deliver the baby. Preeclampsia does not go away until the baby's born. It's not very well understood what causes preeclampsia, but we know that risk factors are a first pregnancy, older age mother, women who have high blood pressure before pregnancy, obesity, diabetes, etc. So can pregnancy physical activity decrease the risk of preeclampsia? There are a number of studies and the results are very mixed. No studies have found reduced preeclampsia with light or moderate intensity physical activity. 3 studies found reduced risk with vigorous intensity physical activity before pregnancy, and 1 study found an increased risk of preeclampsia with vigorous intensity pre-pregnancy physical activity. So basically we don't really know. the information is confusing and it's hard to make any definitive conclusions. Now let's talk about physical activity and miscarriage. Unfortunately, miscarriage is very common and it occurs the numbers are very hard to interpret, but maybe as many as 1 in 3 pregnancies. Some say 1 in 6 pregnancies. The reason it's so hard to study this is because a lot of times the miscarriage happens so early that the woman doesn't even know that she's pregnant yet. Most miscarriages occur in the first trimester, and typically the cause is unknown. Sometimes it seems to be due to genetic abnormalities in the fetus, but often no identifiable reason. So there's been a lot of concern historically about physical activity potentially causing miscarriage. So again, the results are very mixed. Some studies say there's an increased risk, some say a decreased risk, some say no relationship. There was a very famous study that was published in 2007 out of Denmark, and this is the BBC News screenshot, and you can see the title, Heavy Exercise Miscarriage Link. Strenuous exercise early in pregnancy could triple the risk of miscarriage, according to Danish researchers. So this got a lot of media attention. But what they don't show is that they also did a second analysis where they excluded all of the women who reported their physical activity after they had a miscarriage. I want you to think about a woman who has a miscarriage, and then a researcher comes and says, "Can you tell me about all the things you did during your pregnancy?" This was a case control study. So think about a woman who was a control. She didn't have a miscarriage, and the same researcher comes to her and says, "Can you tell me about all the things that you did when you were pregnant?" There were some women who reported their physical activity before they had a miscarriage. When they analyzed only those women, there was no relationship between physical activity and miscarriage. So what's probably happening, what that means, is that there's probably a recall bias. We see this in studies where some adverse event happens, like a miscarriage. What's happening, I think, the data suggests, is that women who had the miscarriage remembered events that happened before that differently than women who didn't have a miscarriage. Something bad happens and they may overanalyze. "Oh my goodness, I went for that run that one time." Whereas a woman who didn't have a miscarriage may forgot that she went on a run. I mean, it's similar to if somebody gets cancer and you ask them about, have you ever been exposed to any chemicals? If someone has cancer, they may remember things really differently than somebody who doesn't have cancer. That's called recall bias, and I think that's what's going on here. But to be fair, to look at all the miscarriage and physical activity literature, not just this one study, we really don't know. It doesn't seem like miscarriage risk is higher, but it also doesn't seem to be low. I wanted to show you this. This is another screenshot from the website. CrossFit and Pregnant is the name of the website, and you can look this up if you want to. This woman is 9 months pregnant. Just the point is, there's a wide variety of opinions about physical activity during pregnancy, but according to the physical activity guidelines, which are based on research, physical activity is safe and beneficial at moderate intensity for all pregnant women, unless there's some medical condition. But in a normal, uncomplicated pregnancy, it's safe. And vigorous intensity physical activity is safe provided that the woman was vigorously active before pregnancy and she continues to consult with her physician. Okay, now let's talk about physical activity in children. I know there are quite a few elementary education majors in the course, so I hope this will be relevant for all. I think you're hopefully all aware of this, but children are not just small adults. They are physiologically, psychologically different. In terms of physical activity, they're different because they need more physical activity. Remember, they are the one exception to the physical activity recommendations of 150 minutes per week. Children actually need 60 minutes per day of physical activity. Very briefly, let's talk about growth in kids. The rate of change in height and weight is the fastest in infancy and the early toddler years. So from birth to 2 years, these infants triple their birth weight, sometimes even more than that. So incredibly fast rate of growth. And then at about age 2 to just before puberty, the rates of growth slow down. And then you have the onset of puberty. Sometimes this is called the growth spurt. You may be able to think back to your early adolescence and remember your growth spurt. And then after that, from mid-puberty to the late teens, that's growth slows again. The height and weight changes are they don't occur at the exact same time. So typically what happens is that the height change occurs first. So you have the growth spurt in height first. This happens at about an average age of 12 for girls and 14 for boys. And then typically about 6 months later, the children, adolescents, catch up, if you will, in weight. So the weight change then occurs. So the concept of peak height velocity is important to address. This is just, velocity means basically speed. And so this is the fastest change in height. So basically, again, the growth spurt. So you can see the boys is in blue, girls is in red, and the peak height velocity, the fastest rate of growth in height occurs at about age 12 for girls and about age 14 for boys. So how is this related to physical activity? Well, if you think about training young athletes, there's a lot of controversy about especially resistance training in children and adolescents. Training programs for kids should definitely be fairly conservative. This is to reduce risk of injury and overtraining and loss of interest in the sport. There's much debate about sport specialization in kids, and that's really outside the scope of this class, but just know that that's a big issue. There is, the American College of Sports Medicine has made an official position stand on resistance training in children, and they say that an age-appropriate resistance training program is relatively safe, but age-appropriate is the key term. An 8-year-old would not be trained the same way as an 18-year-old, for instance. Aerobic training does improve endurance performance in children, so children can be trained to run faster, perform better, but it does not increase their VO2 max or their aerobic fitness. They don't improve their ability to utilize oxygen until later on. So to continue on talking about training the young athlete, the anaerobic capacity increases. This is their ability to do work that's like very hard, fast, high intensity. Training typically does decrease body fat, increase muscle mass, and increase total body mass. But there's been a lot of concern about, can this type of training stunt growth? And research shows that it appears that training does not at least significantly alter growth and maturation rates. So again, age-appropriate resistance training seems to be pretty safe. 10-year-olds do not need to be doing 1-rep maxes, but there are things that can be done safely. Of course, there are a number of benefits of physical activity in kids, and basically they're similar to adults, but there are some more psychological benefits, I suppose. In addition, so in kids there's weight control just like with adults. A concept called tracking says that kids who are active tend to become adults who are active. with children, physical activity is very important in developing motor skills. If a kid never learns to hop, skip, run, jump, then they're not very likely to be physically active in adulthood because they don't know how to do those things, and at that point it becomes awkward to learn. Developing bones are strengthened. There's increased confidence, decreased stress, social skills are improved. Kids who are physically active sleep better, and every parent wants that. Fewer behavioral problems, longer attention spans. A lot of the benefits to physical activity in children in particular have to do with cognition and the brain. It just seems to help their focus and their ability to eliminate distraction. So how do we get kids to be physically active? It depends on the age of the kid. So for infancy, this has changed quite a bit over the past years, but current recommendation is that babies should sleep on their backs. Back is best is the phrase that's used. So the one drawback to that is that infants typically crawl later than they used to when infants were advised to be put to sleep on their stomachs. So what is recommended is called tummy time. Basically just put the baby on his or her stomach for a few minutes several times a day. This allows the baby to learn to strengthen those core muscles and neck muscles that will allow them to eventually crawl. And then of course do all the things that come after crawling. With toddlers and preschoolers, they should have active playtime every day, indoor and outdoor. Obviously sometimes that's not possible with weather and so forth, but as much as possible they should have indoor and outdoor active play. For toddlers, these are recommendations specific to like daycare environments, but obviously children who are at home should still have active play as well. For toddlers in a full day program, they should get 60 to 90 minutes a day of active play. For half day programs, 30 minutes or more. Preschoolers actually need even more. They really need 2 hours a day of active playtime. And then of course we need to keep in mind kids with special needs. It's very important that they are able to participate as well, and so modifications can be made depending on. There's structured and unstructured physical activity. Structured is defined as organized, quick, intense activities led by adults. So I'm going to give you a few examples of those. Unstructured is simply letting kids play. This is what they do naturally all the time. Be outdoors as much as possible, especially with young children. A couple concepts to keep in mind are warm weather ready, meaning be on the lookout for an opportunity to be outside. In Alabama, we have a lot of warm weather, but different parts of the country, it's more challenging to be outside frequently. Coats and hats and rain jackets and snow boots, all of those things allow kids to be outside. So when at all possible, have the mindset that it's worth a little bit of discomfort getting outside the comfort zone to have kids play outside. And then have indoor options like a gym, classroom, or a room in the home as well for both structured and. So here's an example of a structured activity. You would print out a big rainbow like this, or you could put it up on the wall and say, run, touch the yellow. Or you can, if you don't want to do that, you can just call it the rainbow run and call out red, and kids run around the room and touch 3 things that are red. It helps them learn colors, and it helps them be physically active, and they don't even realize it. Here's another example. Sing a song with something repetitive in it, like My Bonnie Lies Over the Ocean, and every time you say Bonnie, they jump, or they skip, or they touch their toes, or whatever it is. That, again, they don't realize this is to get me to be physically active, but it is. So obviously that was all relative to very young children. What about school kids? This study was done looking at the mean or average steps per day for school-age kids in grades 1 through 12. The black bar is males, the gray bar is females, and what you see is a couple of important trends. Males are more active than females on average. We see that in all kinds of research. And the other thing is that as kids get older, their physical activity levels go down. That's true in males and females. And we've seen that in lots of other research as well. So another question is, when are they active? Is it during PE? Is it at school? Is it sometime outside of school? This is showing the division of steps per day and all of those things. So you can see in PE, boys are getting around 1,500 steps, girls slightly less than that. During school, boys are getting around 4,000 steps, girls only around 3,000. Outside of school is where they're getting most of the activity. And so you can look at this a couple of ways. You could say, oh my goodness, we really need to increase physical activity during the school day and during PE. Or you can look at it and say, hey, kids are getting most of their activity outside of school. Let's not bother with school. Let's try to intervene outside of school. You could probably make an argument either way. There is a relationship between fitness and academic success. Now, there are a lot of potential confounders, and it's a little bit hard to study this, but a fitnessgram is a way to assess physical fitness in school-age kids. Basically, there are 6 different standards, and if you pass 3 of them, you would be under the 3 column, and if you pass 5 of them, you'd be under the 5, and if you're very fit, you would pass all 6, and so forth. And so what you see here is a relationship. This is a cross-sectional study, a relationship between the number of fitnessgram standards that the kids passed and their score on a standardized test. So again, it's a cross-sectional study, so we know that fitness is related to academic test scores. However, that doesn't necessarily mean one causes the other. We can't say that for sure. What about physical education, PE? This data is from a website called Fit America, and it says that kids who have PE are more likely to be active outside of school. So the blue bars are kids who have PE at school. The red bars are kids who don't. You can see the differences in participation in team sports outside of school, 50% versus about 17%. And there are similarly large differences in all kinds of things like outdoor activities, cycling, running, etc. Again, we can't say that one causes the other, but these 2 things are related. In terms of adults, they looked at adults who had PE when they were in school, and about 20% of them are totally inactive today, versus adults who did not have PE in school. About 41% of them are totally inactive today. I'm going to actually skip through this particular. I've seen it before. Let's talk about the PE requirements in Alabama. In K-8, Alabama requires 30 minutes per day of physical education. This cannot include health education. That has to be taught separately. So this is actually a fairly unique requirement. Not every state requires physical education. So I think this is it's unique. In high school, there's a lifelong individualized fitness education or LIFE course that's required for Alabama students to graduate. However, they can petition to waive this requirement. The things that typically count is a student who is on an athletic team, in the marching band, or in the JROTC program. Those students typically can request the. So today you're going to participate in discussion 4. I will email you your final exam by 8 a.m. tomorrow, and then you will return it to me via email just before midnight tomorrow, Friday, and then final grades will be posted early next week. Please feel free to email me if you have any questions, and I hope that you've enjoyed the course, and I certainly have. Thanks.